Good morning, everyone, or good afternoon, depending on where you are. Welcome to Mental Health and Wellness in the Workplace. I'm Katrina Bell. I'm one of the founders of ZUNA. ZUNA is a finance and benefits consulting firm headquartered in Portland, Oregon. And I have been working with clients on financial wellness related topics for many years. And there's always been a profound connection between overall health and wellness and the work that I do with employees on a day-to-day basis. So I'm very excited to be here today with a great ZUNA partner, Parker Smith and Feek, to talk about this important topic. So today I want to cover a few housekeeping items before we get going. You can submit questions at the Q&A box at the bottom of your screen, and we will try to get to them throughout the presentation and or between segments or at the end of the presentation today. We will be conducting several polls throughout the presentation, and so please watch for that because we'd love to hear your experiences and thoughts as we go along. We've muted your audio. If you would just double check it, we would appreciate that to make sure that everyone is muted. And then we will be following up after the event with an email with a recording of the presentation, the PowerPoint slides, and any resources that we discussed today. And so with that, I will give brief intros of our presenters, and then they will tell you a little more about themselves when it comes their turn to speak. I promise you a great presentation today. We'll start with John Feltz, who is VP and Regional Benefits Manager. John is going to give us the overall landscape of mental health and wellness right now, and specifically how that's been impacted by the pandemic. And then we'll go to Christy Clark, and Christy is a wellness account executive, and Christy has some great ideas that she'll share on how you can create a more healthy workplace for your employees. And then we'll go to, lastly, my friend, Kristen Duvall. And Kristen is an account executive and also my co-planner on this event. Kristen is going to talk to us about Section 139 plans, and these are disaster relief plans. They're very interesting and very timely, and she's going to talk to us about how you can utilize these plans to assist employees who have been impacted by COVID. So thank you again for being here, and with that, I will turn it over to John.
Thanks, Katrina. Happy to be here as well. A little bit more about me. Part of this, the reason this is a topic near and dear to my heart is it's what I studied in undergrad, and we'll talk a little bit more about sort of the dynamics of the environment with providers and what we're looking at in the current environment, maybe in the future environment too. But I'm going to start with a poll just to get a sense of everybody's interest and or involvement with mental health today. And I'll read the poll for the folks that may be just dialing in on the phone. And I'll also read the responses to make sure everybody knows what the responses are. So first, with the poll, please check all that apply that complete the statement. I have, first, lost a friend or family member to suicide. Second, been significantly impacted by the suicide death of someone who is not a family member or close friend. Third, lived with a mental health condition or substance use disorder. Fourth, supported a friend or family member who has lived with mental health condition or substance use disorder. And last, none of the above. So just to get a sense from the audience of where you're at and what you've experienced, it'd be great if you could submit your responses, and in a moment we'll read the answers off. So while we're doing that, the reason this is a little bit more near and dear to my heart is about 20 years ago, I lost my brother to alcohol addiction. And of course, I think that's something we're seeing more and more with addiction as people struggle with. And I've had numerous issues with both of my kids having mental health needs for resources, whether that's issues with school and bullying or just the stress of daily life. And it seems like almost everybody I know is dealing with something similar. So if we can pull up the responses, that would be great. So 32% of the people on the line have lost a friend or family member to suicide. 16% have been significantly impacted by the suicide death of someone who is not a family member. 16% have lived with a mental health condition or substance use disorder. 72% have supported a friend or family member who has lived with mental health or substance use, and only 20% of the folks on the call today are none of the above. So it is pretty prevalent, and we will go to the next. Actually, we'll stay on this slide for a moment. So you can read the definition of mental health by WHO, but basically what I want to do is sort of frame this from an employer perspective. Mental health is fragile, and it's becoming, I think, more fragile in the time of COVID, and the need for resources is actually going up. So what happens if people are in a position where their mental health is compromised? Well, your thinking is compromised, your decision-making is compromised, your ability to manage workflows is compromised, and your relationships are compromised. And when you wrap all of those four things together, that's really what leads to productivity. So from an employer perspective, when you're dealing with mental health issues with either your employees or their family members, because take it from me, even if you're not the one dealing with it, it does affect you significantly. You're dealing with productivity issues. A recent poll suggests that 86% of human resources professionals are very concerned about mental health in the workplace. And there sometimes can be a disconnect between finance and human resources in terms of investments for the future. And we'll get into some more of that in the coming slides. But I think part of that is things like productivity are really hard to measure. And it's hard, they're kind of squishy, kind of hard to get your arms around. So I'm going to try to support that squishiness with some facts that may help you if you want to make some additional investments. Next slide, please. So prior to COVID-19, we had issues. Loneliness was being described as an epidemic. It seems like the more we get connected online, the less we get connected with people personally. Second, opioid addiction, in my opinion, was the biggest national issue we've had in decades. And that's actually gotten worse during the pandemic, but it's not getting much press because there are other things to fill the headlines, unfortunately, that aren't helping mental health either. Third, we're dealing with a changing workforce. So right now, millennials and Gen Z make up the majority of the workforce, and they're only going to make up more of the majority of the workforce. And with that dynamic, the stigma associated with mental health is diminishing. So they're desiring more access to more resources. And those three things combined, the increase in loneliness, the changing workforce dynamic, opioid addiction, they're three of many things that are leading to a significant increase in demand on the healthcare system for mental health resources. The problem is the supply of those resources is going down. I graduated undergrad in 1992 with a degree in clinical psychology. And at that point, I had to make a decision. Am I going to go back and get a further degree and make this a profession? And at the time, Hillary Care was coming out, and there was talk of defunding mental health. And I came from a lower middle class family. We just didn't have an option to say, yeah, we'll spend money to go for 4 more years at college, and then maybe you'll have a job coming out of the back end of it. So we really have baby boomers who are retiring and not enough people coming in to replace them in this profession. So there is this shrinking supply of resources while we have an increasing demand, and it's creating a problem. So next slide, please. We're going to launch our second poll here, and it's related to the second circle. So if you could pull up the second poll, Michelle. I'm giving you the answer because we did it a little too quickly, but according to a study from Express Scripts, what was the percentage increase in utilization of anti-anxiety medications in the first 4 weeks of the COVID-19 pandemic? So I'm gonna skip the answers because it's sitting in front of you. I gave you the cheat sheet. The answer is 34%. So for the first 4 weeks of the pandemic, the increased use of anti-anxiety medications was 34%. We're not talking from a low denominator. It was already a significant number. So we know that COVID-19 is impacting the environment that we're living in from a mental health perspective. The first 3 circles, 18.9% is the number of people in the United States living with a mental health disorder. The 60% is 60% of the population of the United States is living with a chronic condition. And when you combine those 2 things, if you have somebody who has a mental health disorder and a chronic condition, the cost of treating those people are 2 to 3 times higher than if it were just one or the other. So it is a costly situation that we're dealing with. The third slide, the 38%, I believe, yes, is the increase in antidepressant utilization in teenagers between the years of 2015 and 2019. Now, there's other statistics that I'm going to throw your way too that aren't on this slide. Our pharmacy utilization in general is outpacing medical trend. So if you were to look at the cost of pharmacy, that's increasing faster. So is mental health. The cost of mental health is outpacing normal medical trend. The frequency of these conditions and the frequency of these pharmacy medications is really, really high. Now, the good news is they're fairly low priced, but if you look at, and part of what we try to do as a consulting firm is to get access to information. And that's not always easy based upon the size of the firm you're in or the type of insurance arrangement you're in. But if you can get insurance reporting from your insurance carrier, it will tell you usually in the top 10, there's a couple of different categories of pharmacy medication, either from a cost standpoint that are driven by mental health, but the frequency of those prescriptions is really, really high, and it's only getting higher. Lastly, another cost that you need to be aware of is the cost of turnover. So if you have somebody who's depressed, they're 2 times more likely to leave their job than somebody who's not depressed. And we were coming from, prior to the pandemic, the tightest labor market we had ever seen. So for some of us, that's changed. For some of us, that hasn't. For us personally, it hasn't. So there are other costs that are really leading to what a financial person would want to say, is this worth our time investing in more resources? But there is a quote that I like from Mark Twain that says, there's lies, there's damn lies, and then there's statistics. So some of these statistics ring true, but I'll tell you a personal story. When you're dealing with mental health issues, it's kind of a slow creep. And then there's a moment where you, oh crap, we really need help. There's something going on here that we just can't handle ourselves anymore. And with our kids, when that moment happens, you scramble. You're just, where do I go? Who do I find? And who do you go to? You go to your friends. You go to your doctor. You go to the school, and they all give you lists. And then you call the lists, and the lists say, nope, I'm full, not accepting patients. Nope, full, not accepting patients. Full, not accepting patients. And about the 10th or 15th phone call you make, you probably get somebody that says, sure, we can help. Well, after that happens, you then ask the next big question, which is, do you accept insurance? And much of the time they don't. The reimbursements from insurance companies are pretty low for mental health services. And many clinicians, if they're not associated with a big facility, won't accept insurance payments. So a lot of the costs that you see in your health plan are not really reflective of what's actually happening in your health plan, because I've seen probably 8 or 9 different mental health professionals with my family over the years. Only one of them has accepted insurance, and for none of the others have I submitted claims, because I can pay for them directly at a lower reimbursement than I would if I were to submit through my insurance company. And they're out of network, and they go to my out of network, out of pocket maximum, and who cares? I'm not hitting that, so I'm not submitting them. It's not worth the effort. It's a waste of time. So some of these statistics underplay the availability of the resources, number one, and number two, the expenses that you're really seeing in your plan and the expenses that your plan is really incurring. And I would question, what is the value of your health plan if you're not covering some of those things? So next slide, please. The good news is I think there is room for hope. And where is this industry heading? There's some things that have happened really quickly as we've kicked off into this environment, and the use of telemedicine is at the top of the list. It's not only is telemedicine increasing, is the utilization increasing. People are getting over that 1 or 2 steps you have to go through to access care through telemedicine. It's not a mystery anymore, and it's not that hard. All the telemedicine providers are investing additional dollars into mental health as well. So they've added mental health resources to their portfolio and invested more in that. Secondly, carriers have been really quick to add telephonic visits at the same reimbursement level for mental health providers. So the current situation where you're dealing with a provider and all of a sudden you can't go into the office, Well, they've allowed those providers to maintain continuity, and they've enabled virtual care for those providers really quickly. So I do see things happening in our market that it's the Uber of everything. It's matching that supply and demand curve. And we know we have a diminishing supply and we have an increasing demand. So these vehicles, whether it's virtual visits or others, we're enabling that curve to meet and creating more efficiencies to get people the help they need. Next slide, please. So as we look at these statistics up here and these, not statistics, but these notes up here, I think we need to look at what your employees and their families are facing. That's the reality of what we're seeing on this slide. And again, when you're dealing with scrambling to try to find resources for your kids, you're not all that productive at work. I'm just telling you, you're not on your game. And if you're dealing with them for yourself, you're not on your game either. The political climate, the protests, COVID-19, these are all going to leave residue on people. Think about kids who haven't been able to meet their classmates. I've hired probably 10 new employees who I haven't had a chance to meet yet. And so I'm in the Lung Association. I'm the board chair of the American Lung Association up and down the West Coast. The wildfire season 3 years ago will affect lung health for the next 40 years. That's how bad the air quality has been. And I think this environment that we're living in through COVID, the political environment that we've been living in, it's going to be the same. I don't know if it's 40 years. I don't know how much residue that leaves or how long it carries on, but people are going to need help and they're going to need extra resources. So the good news is we've been quick to adapt. And I sat through a seminar about 15 years ago about healthcare costs. And one of the panelists was asked the question, we can't keep doing this. The percent of GDP doesn't make sense. It just doesn't, how is this going to continue? And his response was great. He said, our system does a really great job of reforming itself. We just have to be pushed to the absolute precipice to do it. And I think that's where we are. Our providers going to continue to deliver care like they are today. They've had to do things quickly. They've shown how quickly they can adapt. Insurance carriers. And Christy's going to go through a lot of other resources as well that you can look to. But my personal plea is think about it. I've been through it. Your employees are going through it. Even if you don't know they are. Ask them about how they're doing. Build tools for them because it's going to impact your business. It's going to impact your bottom line. And it's going to impact your people. And that is your bottom line. So with that, I'm going to turn it over to Christy. Let her introduce herself. And hopefully I didn't go too far over.
Oh, you're fine, John. Thanks very much. So I'm Christy Clark, and I'm the Wellness Account Executive at Parker Smith & Feek, and I work with Kristen and John on our clients. We're a full service brokerage firm, and we're in the benefits department. So if there's a client that wants to talk about wellness or put together a wellness program, that's when I'm brought in. I've been in the insurance industry in account management and sales since the 90s, so a long time. And mid-career, I shifted gears a bit and went back to college and got a master's in public health. So I'm really passionate about health promotion and population health in general. And when this COVID crisis came along, I went to John's office and said, this is a really big deal in public health. We need to be on top of this. And so as an industry or as a company, we've been doing lots of talks like this, whether it's surrounding mental health or vaccines coming up next. We're engaged, and I'm going to share what we've seen since COVID from different human resource studies, as well as some resources and tools that employers can use, as well as individuals. So when we're checking in with people now, it's common to say, how are you? And really, not just do you have COVID, but how are you doing? Because we're all being impacted by this pandemic in a mental health sense. John shared a lot of the numbers of what was happening pre-pandemic, but some of the things I want to share with you are from SHRM, the Society for Human Resources Management group that they did in the spring. I think this was in June. So it's it's been a little while, things have changed since then, but these are still good statistics. So a lot of people are concerned about a family member, so not just themselves, but a family member. With 58% of the sample had at least one person in their household that was considered in a vulnerable population. So people aren't just worried about themselves and how this is impacting them, but their family members who might be vulnerable, or their kids who, this is impacting because they've been home from school for so long. Women are more likely to report having a harder time concentrating than men. So 54%. Over 1 in 3 employees report often feeling tired or having little energy. I can relate to that one. Only 7% have reached out to a mental health professional. So we just talked about the issues with mental health, but people aren't necessarily seeking care as much as they could be. 41% are feeling burned out from their work, and 45% are feeling emotionally drained from their work. Less than 40% are getting enough sleep or feeling rested. And here's a plug to you managers out there. 63% note that their supervisors have adapted well to the changes with COVID-19, so that's positive. And as John also mentioned, we've got these extra stressors on top of COVID with political unrest in our cities, as well as the wildfires that we've all been impacted by. Next slide, please. All right, so here's a breakdown of how it's impacting generations from this SHRM study. So no surprise, Gen Z, the younger generations, and the millennials are having a harder time with being emotionally drained. They've had less life experience and less resiliency built up on how to handle some of these challenges that come in life. Next slide. And as we mentioned before, we're all feeling this. So 2 in 3 are experiencing depressive symptoms at least some of the time. You can see from this slide that with a percentage of people that are feeling tired or having less energy, feeling down or depressed, and having trouble concentrating. Next slide. So how do we create a healthy workplace? We're going to talk about some of the things that you can do as an organization to create a healthier workplace. Next slide. Oh, we've got a poll here. So if you could run the poll, we're wanting to know, are you investing the less, same, or more in wellness currently as an organization? All right. Hopefully that's enough time. We're going to compare what you have said. So 5% less, 74% the same, and 21% more. So how does that compare to the Wellable 2020? Go ahead and close that. So Wellable, so pretty close. 80% are investing more, 15% the same, and 4% less. So this is a industry trend report that was done in 2020 about what employers are doing. So next we're going to talk about some of the things that you can do and what employers, where they are investing currently in wellness. So the percentage of organizations that offer mental health and behavioral health initiatives are as follows. So 90% are investing in an employee assistance program. That is something that obviously most employers have, but many are not using it. There's a note. Sorry, I'm getting distracted by that.
Christy, it was the results on our panel from the questionnaire were different. They were flip-flopped. So,
okay.
4% were investing the same, when in the results that you showed, 80% were actually investing more. So there was
okay.
Between the.
So the Wellable report was nationwide, and in the West, I think we're a little more wellness focused from a mental health and holistic standpoint than in some parts of the country. So in some parts of the country, EAPs are kind of new. And I know I work with a group of brokerage firms around the country, and there was a big push last year to implement EAPs because a lot of companies didn't have them, and we find that most companies around here have them and have had them for a while. So one thing about the EAPs on this slide is that they're not very well utilized. So employers have them and they're great for crisis situations. So if there's a injury or a death in your workplace, they're great at bringing people in and kind of talking through that and helping people grieve and move on from that. But a lot of people don't necessarily use them for their family members, and they're available for all kinds of things. I used one recently. My mother has a little bit of, not a little bit, but a lot of dementia and needs some help at home. And they helped me find people that could come into her home to help out a couple times a week. And I didn't know where to start on that. And they put me in touch with some different organizations that I could interview. So it's a great first step. Most of the time, they're available for the whole population of your employer group, not just those covered by benefits, and for all family members, whether they're covered on benefits or not. There's usually a certain amount of visits that you get with a licensed professional. They're usually master's level trained in psychology or some kind of counseling, and you get 3 to 6 visits typically via telephone. And then they can, if you need more care or need to be connected with resources, they can then refer you on. Employers have mental health coverage, 86%. And even though there's mental health parity and it's supposed to be covered under health plans, as John mentioned, there are many times that you can't get it covered under your health plan just because they're not in network and it's hard to find someone. So there are some improvements that could be made there. Same thing for substance abuse treatments. It's covered under most health plans, but oftentimes the provider network is lacking. So there are many of the carriers are covering additional mental health needs telephonically, as John mentioned, with telehealth. So Primera Blue Cross has a 3-visit EAP for a lot of their programs, and they have new programs for addiction that they're rolling out this year. Cigna is one that has something called Happify. That's an app that can help you look at the glass as half full. There are seminars on stress and resilience that they offer as part of their programming often. Kaiser has something called My Strength, which is a mental health program. All right, there are mental health education sessions, and I'll talk about that a little bit more in a moment. Some are offering mindfulness classes. We have one client that does eye transplants for people. So super stressful job for their employees. They need to call people, family members of someone who is recently deceased, and basically ask for like an organ donation of eyes. They work 12-hour shifts and they're super stressed out. You can imagine those are really hard conversations. They brought in a guided meditation program, and they are around the country. They had it in their Seattle office live, and then they recorded it for their other places around the country. And they did that for a whole year, and it really helped their employees. They now know how to meditate on their own, and it really has helped relieve their stress. There are other stress management programs available that I'll briefly talk about, and mental health first aid as well. And then 11% are putting together resiliency programs. Mental health, go ahead, yeah. Mental health first aid is something that was becoming popular before COVID, where professionals actually, they can come on site to do this, or you can go to a program where they're doing this, and it teaches managers how to learn about mental health conditions, understand and respond to signs of addiction of mental health. It's about an 8-hour course, so it's a big investment of time, but well worth it if you can catch something earlier or really help an employee to get the help that they need. Next slide. Another resource that one of our EAPs that we work with quite a bit is doing is Cascade Centers. They're local, and they have something called Whole Life Direction, which is a mental health risk assessment. So a lot of times employers do biometric screenings and health risk assessments where you talk about your physical health and your nutrition and whatnot, and kind of get an overview of what your health looks like. But this one is on how you're doing mentally. You take a quiz, you select a goal, and then you start sessions. So based on your answers on this, you kind of get a track of where you want to go for your mental health and making improvements. Mine was needing more sleep, and what are some things that that I can do to work on to make sure I'm rested and ready for everything that life's going to throw at me the next day. All right, next one. So other resources that are available to employees and their families. So first of all, how do we create a healthy workplace? First, with coming back to work or working remotely, making people safe in the workplace, make sure you're following, the basics of COVID precautions. Early on in this pandemic, we polled our employees, and it was similar to the SHRM results, that people were worried about other family members, and they were really scared about coming back to the office. And so making them know that you're taking the precautions needed, that they're not going to get it at work. And I just can't say enough about that. Develop the positive aspects and strengths of employees. So we're all having challenges through this. When people know their purpose and how they fit into the cog in the machine of your organization, that will help them be a better employee just in general. You can provide upstream recognition or challenge it, which influence and build resilience. So gratitude exercises. So we have one client, this was pre-COVID, but they're up in Alaska, and they have a health fair every year. And one of the activities that they did in health fair, this was in their boardroom, was that everyone, they're in a fishing town in Alaska. So everyone took a cutout of a fish, of a coho salmon, and on that fish, they wrote something that they're grateful for. And they made a river of gratitude that went around the whole boardroom. And it was just so much fun to see what people were thankful for, and to see it just kind of flowing through the room. It was really uplifting, and they left it up there for a couple months because it was fun to see that. We talked about mindfulness. Another thing you can do is journaling. Gosh, especially through this crazy time. Someday we'll tell grandkids that we were living through COVID. I did it at the beginning. We have to stay home and this and that. I need to do it again with. I don't do it enough, but to journal kind of where we are from March or April, whenever it was that I last wrote, but just to kind of get it out, what we're going through, what you think about it. Humor. I've watched more Saturday Night Live in the last couple months than I have in years, and you can't say enough about that either. And silly cat videos. And then getting outside, little things like getting outside and getting some fresh air can really go a long ways. So I want to talk next about Laura Santos. She's a professor of psychology in Yale, and she actually takes this to the level of academia where there's a whole class on happiness. And when they started it as a psychology class at Yale, they had to move it to the Performing Arts Center because there were so many students interested in taking this class that they couldn't do it in a normal conference room or classroom that they had for students. So some of the requirements or rewirements of the class, and if you do them, you will feel better and hopefully be happier. And Yale students get into Yale because they usually follow the syllabus and are good students and do their assignments. So I'm going to talk about some of the requirements or rewirements of this class, and hopefully you can work them into your own life as you see fit and whatever works for you. But we have control over our own happiness. Some of it is genetic, 50%, but the rest we can control. And it really works if you look at the glass half full rather than half empty. And that's a lot easier said than done, especially with what we're going through. But if you you can build this by doing things like gratitude journals, and it can really shape your outlook on life. The circumstances of our life don't matter as much as we think. She teaches that, and she has, the poo emoji happens 10% of the time, and we have to be able to go through that. So maybe more than 10% of the time this year. It takes effort and commitment, and knowing is not enough. You need to take action and build habits. And a lot of wellness is habit change and behavior change, and that takes effort. So she has one study that she talks about where your mind is lying to you half the time, and she talks about financial health. And there's a study where people who make over a certain threshold don't have any increasing happiness with more income. She says to make time for social connections, to spend time with people that you care about and that can fill you with positivity. Make time for gratitude each day. We talked about a gratitude journal. Healthy practices matter more than we expect. So the exercise, if you do 20 minutes of exercise each day, that can give you a positive mood boost up to 18 to 20 hours later even. And it matches the same results as Zoloft, which is a antidepressant medication. So pretty strong. Same thing with sleep, 8 hours a day. They, with their class, they followed a program where some were only getting 4.5 hours of sleep a day, and they were clinically depressed if they were only getting that much sleep. So anyway, this class goes on, and I won't talk about all of the elements of it, but there's also a podcast that she does. If you look up Happiness and Laura Santos, there's a podcast that you can listen to and take the class. So that's for you to take with you and take what you will from it. Next slide. So some of the things that you can purchase on your own or as an employer, there's this Tomorrow Health is one that is on behavioral science on making changes. It started out as a smoking cessation program with research done by Fred Hutchinson Cancer Research Center, or the Hutch, in Seattle. And it's about behavior change as far as with smoking, like letting urges pass. So if you can let the urge to have a cigarette go for 2 or 3 minutes, then it will pass. So, but they've also used the same behavior change logic to quitting vaping, as well as weight management, stress and anxiety, and chronic pain. So that's something, there's an app that you can get on your own, or employers can purchase it, that has all of these different elements to it. Next slide. So here are lots of resources for you to use as employers that you can look at personally or for your group. So the first one is, John wrote an article earlier this year about navigating through mental health. And then there's some others on suicide prevention. We partnered with a psychologist earlier in the year who was a specialist in that space. And then Heal Bright, as well as Mequilibrium and Will, are all resilience programs. Tomorrow, which I just mentioned, Happify, and then Cadence Online is for parents. So hopefully that gives you a sense of what you can do for your employees and for your families to hopefully be more resilient through this. And next, I'm going to pass it on to Kristen.
Thank you, Christy. Sorry, I didn't mean to rush on that last slide, just trying to stay on top of slide management. Thank you, John and Christy. Thank you for the illumination on the challenges that are facing our mental health and the resources for mental health. And thank you, Christy, for providing the wellness resources. And those employee assistance programs are so valuable, and especially after listening to John talk about the mental health provider, or the lack of those employee assistance programs, can be a tool for employees to access mental health help now. And what's great about many of those employee assistance programs is it's not just in person, it's really supporting telephonic help, or even texting, and even video chat. And speaking to all the different demographics that we have in our workplace now. I think a lot of the young folks are more comfortable with that text and video support. So lots of different ways to get some mental health resources to employees. So I'm very excited to be here today, and thank you, Katrina, for partnering up with me to bring these resources to our mutual clients. And I'm Kristen Duvall. I'm an account executive with Parker Smith and Feek, and I just joined actually in September with Parker Smith and Feek, and I'm really excited about the expertise and resources that we have to offer to my clients. So today I'd like to give you some information on a tax-favored employee benefit for disaster relief under the IRS Code Section 139. So what is considered a qualified disaster? A presidentially declared disaster warranting federal assistance under the Stafford Act. Section 139 allows employers to provide their employees with tax-favored disaster relief funds for certain unreimbursed expenses. The payments are tax-free, so not subject to income or employment taxes for both the employer and the employee. What can the funds be used for? So they can be used for personal, family, living, or funeral expenses that have incurred as a result of the disaster. This includes the expenses incurred if evacuated due to a coming disaster. Also, expenses incurred for the repair or rehabilitation of one's home or the replacement of the contents to the extent that the need for such repair is attributable to the qualified disaster. Now, these examples fall more under maybe natural disasters like tornadoes or hurricanes. But as you can see with the rest of the list, these are applicable to what we're experiencing under COVID. So medical expenses not covered by insurance, so COVID-related copays, deductibles, over-the-counter medications. These are also reimbursable expenses, including health-related expenses such as hand sanitizer and face masks. Dependent care expenses due to school or place of care closings. So many of you on the call may have that experience in your home or know family or friends that are in that situation with trying to find care for their children while they're trying to carry on working as well. So that includes the tutoring and homeschooling related expenses that you may need to employ. So that's me and my family, and that's been an expense we've incurred under COVID. We couldn't do it without our college student who's helping us, but it's definitely an additional expense. So, and working from home expenses. So everyone working on personal computers, perhaps having to buy a new computer to keep up with their work demands, the printer, supplies at home, including the utility costs associated with working from home, critical care and funeral expenses, counseling, temporary housing, non-perishable foods for reserve. And I thought I would note, I don't see toilet paper listed there. So with everyone rushing to the grocery store every time we get a COVID spike and buying toilet paper, well, those funds would not be reimbursable, but perhaps the rice and the canned beans would be. And additional travel and food expenses for those students that may be returning home. So many of you may be experiencing the college student that has come home and you're reminded of how expensive it is to keep your refrigerator stocked. Those would be reimbursable funds. So what can't the funds be used for? So items covered by insurance or other sources, non-essential items, luxury items, decorative items. So for those of us that may have enhanced our leisure wear for our homework environment or decorated the house as we keep staring at it wanting to do that, those funds would not be reimbursable, though they do maybe improve our happiness at the moment. And then payments for lost income or compensation would not be reimbursable. So do you need a plan document for Section 139? These are not ERISA plans, so you do not need a plan document, though we do recommend that you do put some document or policy in place. And in that policy, you would want to define who is eligible for the funds, what the funds can be used for, which could be as broad as that Section 139 allows for, or narrower if you like. The eligibility for the funds, a statement that the eligibility for the funds is in accordance with the Section 139 requirements. You could state the most the employer would pay for a single disaster. Again, that's not required. There's no limits, except that the amount needs to be reasonable. How employees can access funds, who in your company is administering the program, how long the program will last, and also a statement about the employer reserving the right to terminate the program at any time. So anticipating some of the questions you may have, do your employees have to submit receipts or proof of their expenses when requesting funds? So Section 139 requires little or nothing in the way of record keeping or substantiation, though it is advisable to maintain some sort of recording. So collecting receipts or written confirmation from your employees for those incurred expenses. Do payments have to be reported on W-2 or 1099 forms? No, as this is not income. Is there a limit on how much an employer can pay out in Section 139 payments? And no, other than it must be, again, reasonable and necessary. Is it okay to make reasonable set payments to all employees for a specific out-of-pocket expense, such as specifically work-at-home technology? Yes, you can define it as narrowly as you'd like, or keep it broad, but you may just make, one piece of the puzzle during COVID, something that you are going to help with. And can you create a program for just COVID in this time with no intent on providing additional funds for future disasters? And yes, you can do that as well. We have helped several clients put together documents, the policies for this disaster relief program. So we'd be happy to answer any questions or help you connect as well. Some employers have administered the program internally, while others have used outsourced administrators to administer this program. So at this time, I'd like to pass it back to Katrina, and thank you for your time today, and look forward to staying in contact.
Thank you. Thank all three of you. Those were wonderful presentations. Enjoyed it very much. So thank you so much for attending our webinar today. And as I said earlier, we will follow up with an email that will have a recording of the webinar along with the slides and all of those great resources that the team talked about today. So in the meantime, please feel free to reach out to any of us if you have questions, and happy holidays to everyone. Stay healthy.